So you've completed your pre-op visit. You've had all your questions answered and have followed all your preoperative instructions. You're ready for your surgery, but you are probably a little nervous. We want to help put your mind at ease, so we're going to give you some helpful tips on how to make this day go smoothly. Before you leave your house, make sure you know the location of your surgery and the time you need to be at the hospital. Tampa General has more than 40 operating rooms in various locations throughout the hospital, so it is important to know where you are expected to check in. If you need directions when you arrive at the hospital, please ask any staff member to assist you. It's important that you arrive on time on the day of your surgery. Your arrival time was scheduled to allow enough time to prepare for your procedure. It also allows time for any last-minute tests your surgeon or anesthesiologist may order. Remember, surgery and waiting times are not exact. Each patient is given the time and attention necessary to ensure proper preparation and a safe procedure. Should an unexpected event cause a delay, postponement, or cancellation of your surgery, someone will let you know as soon as possible. When you arrive in your designated check-in area for your surgery, you will receive an identification bracelet and your family members will receive a tracking card. Once you arrive in your designated preparation area, you will need to change into a hospital gown. You will also have to remove your eyeglasses, contact lenses, and dentures before your surgery. If you can't leave these items at home, please leave them with a friend or family member who is waiting for you during surgery. We also ask that you remove colored polish from your nails because staff will check your nail beds during surgery to monitor oxygenation. And finally, jewelry and other personal items are not allowed in the operating room, so please leave your jewelry and other valuables at home. Your safety is our highest priority. The staff will perform safety checks frequently while you are being prepared for surgery. They will ask you to spell your name. They will ask you for your date of birth, and they will also ask you to identify the body part where surgery is to be performed. You'll probably get tired of answering these questions over and over again, but it's a very important part of our safety checklist. Nurses will start IVs for fluids and administer any medications your doctor may have ordered. You will also speak with your anesthesiologist before going into the operating room. When you go into the operating room, your friends and family will be able to monitor your progress through our patient tracking system in the waiting room. The tracking card you received when you checked in contains a tracking number. This is the number that will be displayed on the screen so your family can track your progress. Using the numbers helps protect your privacy. Encourage your friends and family to bring a book to read while waiting, along with a sweater, because it can be a bit chilly in the hospital. If you have brought any comfort items with you, such as a favorite pillow, please have your friends and family hold on to these items until you are settled in a room after surgery. While they are waiting, hospital staff and volunteers can answer questions, and private consultation rooms are available for your surgeon to speak with your family after surgery. But before your day of surgery, here are some things to remember as you prepare. No eating or drinking after midnight the day before. Arrive on time. Check in at your designated area. Leave jewelry and valuables at home. Nails must be free of colored polish. Bring a list of questions you may have for your healthcare providers. No question is silly. And be sure you have a ride home. As you enter the operating room, the first thing you'll notice is that it's very cold and bright. We'll provide a warm blanket to keep you comfortable. Tampa General's operating rooms are equipped with the latest technology and most advanced equipment available. We go above and beyond national standards for infection prevention and cleanliness in our operating rooms. Please ask your clinical staff if you have any questions or concerns about these procedures. As you go into the operating room, you'll see a lot of busy people in surgical gowns. This is your surgical team. In addition to your surgeon and anesthesiologist, there will be surgical techs and nurses who will perform a variety of tasks during your procedure. When your procedure is over, you will be moved to the recovery area. As you wake up from anesthesia, nurses will care for your immediate needs, administer pain medications, and keep your family updated on your recovery. They will ask you to rate your pain on a scale of 0 to 10. They will also ask you to cough and take deep breaths from time to time to help you recover from anesthesia. Unfortunately, it is not always possible for family to see you in the recovery area. However, if you are spending the night after you leave the recovery area, someone will guide family members to your room. While this is taking place, your surgeon may meet with your family members to discuss your surgery and answer questions. We know that during this time your family will be anxious to visit you. If you are going home the same day as your procedure, your nurse will review with you and your family discharge instructions for your home care. If you have questions about your post-operative care after you are home, please contact your surgeon's office. For your convenience, most discharge prescriptions can be filled at our outpatient pharmacy on the second floor of the East Pavilion. If you had any form of anesthesia during your surgery, you will not be allowed to drive yourself home, nor are you permitted to take a bus or taxi. Please arrange for a responsible family member or friend to drive you home. If you need to stay in the hospital, our team of healthcare professionals will do everything possible to make your stay a comfortable one. Please don't hesitate to ask if there's anything we can do for you. Thank you for choosing Tampa General Hospital for your surgery. Our goal is to provide you with the best surgical care available. Your satisfaction is very important to us, and we value your feedback. You may receive a survey in the mail after your surgery, and our goal is to earn the highest score of very good. We hope the information we've provided has answered your questions. Everyone at Tampa General Hospital wishes you a speedy recovery.